Hello, everyone. Good afternoon, and welcome to the last HAWP Healthy Arizona Worksites Program Community of Practice. This is session 5. So we have a lot of great speakers here today to share with us kind of all what they are doing throughout the state of Arizona. Just an overview for today. So first we wanted to kind of touch on the purpose of this project, why we started this community of practice group. And like I said, we have some great speakers today, including myself, to talk about some community engagement opportunities. So thank you to everyone who's here. And then we'll have some time at the end for a Q&A. Before we start, just kind of to go into the purpose of the community of practice, we wanted to find a way to help connect more Arizona worksites together and share practices of what they were doing. So this helps to provide a forum for ongoing learning, opportunities to bring up concerns to other people who maybe are going through the same thing, connect and learn from each other, share best practices, empower your voice, explore new frontiers, also create new events, opportunities, collaboration, and just ongoing networking and professional development. So thank you, everyone, for joining. And then I'll pass it over to Dr. Bennett to talk a little bit more about the purpose of the community of practice as well.
Hello, everybody. I'm glad you're here. This is the 5th and final community of practice presentation. And it really comes from interest on behalf of people who are doing workplace wellness in the Arizona communities. And so this is just a chart to kind of show us where we are as we're moving forward after today. There are, if you can see here, 3 intersecting circles that sort of capture the path ahead. Irene's going to talk about initiatives out of Maricopa County for community health improvement and some data, recent data that has been collected on the need for health improvement in Maricopa and surrounding areas. As we know, Healthy Workplaces has been a very important initiative for the past 4 years, if not longer, with the HAWP initiative. And so one of the goals here in terms of the interface between community health and healthy workplaces is how do workplaces contribute to community health? And you'll be hearing from Chris and her work with Blue Zones, and also from Dan and his work with HOA Arizona, that we're in a situation with regard to health risk and disease risk, that we need to do more interaction and collaboration between communities and healthy workplaces. And I think both the work that Chris is doing with Blue Zones and the work that Dan is doing with Workplace, COA, Wellness Councils of America, Arizona, really speak to that interface. So that's a key part of what we're talking about today. And we're very interested in hearing from you what your efforts are or interests are in those. But the third area, which is really what sparked all of this, was mental health, because the HAWP data that had been collected for the past 4 years indicated over and over again that stress, fatigue, depression kept coming to the surface as key areas of need. And so it's impossible for employers to take care of that by themselves. There has to be some sort of community collaboration with nonprofits and communities, county public health, State of Arizona Department of Health, to build those relationships in order to address mental health. So that's at the core here. And so you can see around the circle, okay, what are these processes? I've already mentioned Blue Zones at the top. Again, Chris will be talking about that. I mentioned WellCo Arizona. Dan will be talking about that. And then on the top, you'll see the future of HAWP, which will be something that is still in the works. And hopefully you'll hear about ways you can participate in the future of HAWP. And then there's also the resilience training. And so we have here with us Diana and Michelle, who talk about ways that you can participate most directly by receiving a resilience training. So that's an overview of what we're going to be talking about today. But the ultimate goal here is how can we involve you? How can we engage you? So I'll turn it back over to Irene.
Thank you. So yeah, I am Irene Cassidy. I am the Community Health Improvement Supervisor currently at Maricopa County. Many of you all are familiar with me and know me because I was overseeing the HAWP program for many, many years at Maricopa County, and that has since transitioned to ADHS. Eileen is the coordinator there that is doing the program. So I just wanted to share a little bit about what my new role is looking like and how it relates to kind of what this project is that we have been doing here. So again, I am at Maricopa County Department of Public Health, and I am overseeing the Health Improvement Partnership of Maricopa County, which you can see in the bottom left-hand corner. This is just a quick structural chart to kind of show where we're at within the county. And HIPMC is a partnership, a coalition between Maricopa County and community organizations throughout the county to come together to do the community health needs assessment and the community health improvement plan. So last year we did the community health needs assessment. We partnered with the Synapse Coalition, which is a hospital and healthcare coalition. They have to collect this data as part of their yearly things that they have to do. So we partnered with them last year. We went through a big data collection where we did the survey. This shows a little bit about kind of how we did that. So Maricopa County is huge. It's the 4th largest county in the United States. And so we broke the county down into 5 different regions and collected surveys in all of these regions. We collected a total of 18,039 surveys, which is a huge amount. We grew a lot from the last time that we collected it, so it's really exciting. And this kind of just shows a breakdown of where we collected those surveys at in some of the different populations that we tried to get for that. And then this is some of the preliminary data that has come out from that survey. So in addition to the survey, we also did focus groups and key informant interviews. And this, again, is kind of a breakdown of what populations we were able to reach with the survey. So I just wanted to share that really quickly. But here's where it really connects to the project that we've been doing here with the community of practice. Some of the preliminary data that has come out is really showing mental health is a huge priority in Maricopa County. So you can see, I'll be sending all of these slides out. I know it's a little bit blurry on my end, so hopefully you can all see it. On the top, we see over half of participants rated their physical and mental health as fair. And underneath that, the top 4 health issues that most impacted participants or people in their household were, in the first 2 are anxiety and depression. And so again, this is from the survey data from those 18,000 responses from people that we got throughout Maricopa County. And that just really goes to show that mental health is a huge priority area in our county right now, and how we really need to focus on that. So that shows that. And from that data, so again, we collected all of that data last year in 2023. From that data, now what we're doing is taking a closer look at it and putting that into a community health improvement plan. So we do this every 3 years. And that is where we take the data and take it to the community to have them decide on like, what are the priority areas that we need to focus on for the next 3 years. So the last time that we did it was in 2018, and the 3 priority areas were access to care, access to healthy food, and early childhood development. So we can see just from the preliminary data that mental health is most likely going to be a priority area in this upcoming CHIP. And how can we kind of come together within work sites and other organizations to move the needle on mental health as an area. So I wanted to share for the HIPMC, we have a QPM, which is a quarterly partner meeting coming up. We do them every quarter where just, again, different organizations and people from the community are invited to come together this is going to be where we're finally sharing the data from the 2023 results. So I showed you a little bit on a couple slides back of the preliminary data, but we're really going to be digging into what they found and starting that prioritization process, which I talked about. So again, mental health will probably be a priority area. So just an open invite for any of you to come to that QPM. Once we have the priority areas, we're going to be doing work groups around them. And so I know a lot of what we've been doing here would be really beneficial for a work group surrounding mental health in the workplace. So I just wanted to share that. And then with that, I will pass it over to Chris, who is the Organizational and Wellbeing Coordinator at Blue Zone Scottsdale.
All right. Hi, everyone, and thank you, Irene. Yeah, thank you. I'm very excited to be able to speak on the Blue Zones project that we're doing. And some of you may be aware, but we are underway on a multi-year well-being initiative, and it's designed to help the people in the city of Scottsdale live better longer and with lower rates of disease. So we're going to be transforming the environments within Scottsdale of where we live, work, learn, and play. And this community-led initiative, it's the catalyst to make the healthy choice the easy choice. And it's an exciting time for Scottsdale as we continue to transform and elevate our community. So today I wanted to provide a little bit of background and information on what Blue Zones is, and then where we are within the project, and then how you could be a part of this community transformation. So we can go on to the next slide. So I want to start with the underlying purpose of Blue Zones, and the same reason some of you might be excited about the potential of this project. So collectively, we're setting out in the project work to empower everyone, everywhere, to live better longer. So that is our mission, and we'll go on. And probably as this group is well aware, obesity is running rampant in the US. About 69% of Americans can be classified as overweight or obese. In addition, with our chronic disease, 6 in 10 adults in the US live with at least one chronic disease: heart disease, stroke, cancer, diabetes. And then 4 in 10 individuals are living with 2 or more of those chronic diseases. And as we know, these are the leading causes of death and disability in America, and also a leading driver of the nation's $4.1 trillion annual healthcare cost. And then along with what you're finding with anxiety and depression, we found that social isolation and loneliness has, well, I'll highlight in our blueprint where we have found that to be an issue within Scottsdale. But, throughout the US, this is a serious and somewhat hidden threat to both our mental and physical well-being. And they had found throughout the US, 3 in 5 American adults, or 61%, say they sometimes feel lonely. And, loneliness is much more than just a bad feeling. It's about both individual and societal health. It harms that. It's associated with a greater risk of chronic disease, dementia, stroke, depression, anxiety, and premature death. So where we live affects how we live. And so for some of us, it can be hard to lead a healthy lifestyle because our surroundings have proven to impact our health and well-being. So in our role with Blue Zones, our question is, how can we fine-tune an environment and ultimately a community to make it easier for individuals to live better longer? Next slide. So pretty much research indicates that genetics contributes to about 20% of our lifespan and our susceptibility to disease. So that leaves the remaining 80% that's influenced by our lifestyle and environment. And, key lifestyle risks for chronic disease are going to be our tobacco use, poor nutrition, lack of physical activity, isolation, and excessive alcohol use. So in an attempt to address health, our culture, we're often adhering to different diets. A lot of them are very restrictive, or we try to put ourselves through intense exercise programs. And we spend more than $100 billion on these diets and these exercise programs, gym memberships, nutritional supplements. And, these diets and quick fixes are largely lead to short-term successes. They rarely are something that sticks, and they seem to be long-term failures. So really our interventions need to be decades long or even a lifetime to truly affect our life expectancy and to lower those rates of chronic disease. So next slide. So how can we live better longer? And that'll be the origin of blue zones and then the related research. So we'll move on. And pretty much blue zones, it all began with Dan Buettner, and he's an explorer, a National Geographic Fellow, award-winning journalist and producer, and a New York Times bestseller. He's got multiple books out there now, and maybe some of you on Netflix have captured, there's a docuseries, a 4-part series that's very well done on the blue zones. But in 2004, Buettner and his team began traveling the world, and they were searching for communities where people were not only living longer, but also enjoyed a high quality of life into their older age. And in association with National Geographic and then funding from the National Institute on Aging, Buettner and team wanted to learn more about the role of lifestyle and environment. And after analyzing data and interviewing numerous centenarians, they identified 5 different pockets, or what we call these blue zones, where it really stood out their longevity and vitality. So the next slide here will show the 5 original blue zones and kind of where they are on the map. But Ikaria, Greece, people on this tiny island are living 8 years longer than Americans do. They tend to experience 20% less cancer, half the rate of heart disease, and experience almost no dementia. We have the Nicoya Peninsula of Costa Rica. They spend 15% of what America does on healthcare, and they are more than twice as likely than Americans to live to the healthy age of 90. And faith and family is huge in their culture. We have Okinawa, Japan, and this is home to the world's longest lived women. And they experience less incidence of cancer, heart disease, and dementia than Americans. We have Sardinia, Italy. This was the first blue zones actually identified and where the world's longest men live. And then lastly, we have one in the States, which is Loma Linda, California. And this is by LA, and it's a community of 9,000 Adventists. And this population tends to live a decade longer than any of us in the US. And one thing that's especially notable is that within each of these original blue zone areas, people weren't intentionally seeking out life longevity. It was just the way that their lifestyle and the environment was. So we'll go to the next slide. So with research came understanding, and there were clear commonalities of these 5 different regions. And what they found, we call these commonalities the Power 9. So with the next slide, we'll just briefly highlight what our Power 9 is. So they are broken into 4 different categories. So we have our movement, we have right outlook, where this focuses more on finding purpose and allowing time to downshift or de-stress. Eat wisely, so eating to your 80% full, mostly plant-based, not that you're eliminating meat or animal products. And they do have something called wine at 5, and not that you have to drink, but it's more that social connection. And then connection itself is a huge component of the blue zone. So, having positive influences around you and your friends, putting loved ones first, and faith-based organizations. We'll go to the next. And in addition to the Power 9, they have another term with our project work, and we call this life radius. So with the next slide, we'll dig a little deeper on that. So research pretty much tells us that individuals spend about 90% of their lives within 20 miles of their home. And so we call this their life radius. And as we discussed earlier, our surroundings really influence our health a lot more, our lifestyle and environment, than our genetics do. So rather than relying on individual behavior change, and with the wisdom that they gleaned from the original blue zones, Buettner worked with researchers to create a plan to optimize the life radius, or where people are living. And in 2008, he created what they call the Blue Zones Project concept. And the Blue Zone projects, they work with cities, organizations, and individuals to initiate change in their surroundings. And we do this through implementing policies and programs that will move the community towards optimal health and well-being. And so we have 3 different sectors. We have people, places, and policy. People, within people, we have volunteerism. It also we do purpose workshops, so we help people understand their purpose. We also challenge them to optimize their home. We have these different Blue Zones challenge that they could go through, where they tweak their home and their social environment to promote their well-being. And then with the policy side, our focus is in 4 areas. So we're going to look at the built environment. So promoting like moving naturally, whether that means widening sidewalks or making more walkable spaces, increase social connection. They look at food systems, so access to healthy food to all. Alcohol, again, not eliminating, but reducing excessive use and or misuse. And then tobacco, so decreasing tobacco use and smoke products. So I just want to dive a tiny bit deeper into places, because that's the sector that I focus on along with another coordinator and our lead. Oh, that's weird. It looks like a few of these things didn't come through on that slide. But pretty much when we talk about places, it's 4 main areas. So we have our restaurants, our work sites, our grocery stores, and our schools. And, you know, as we all know, work sites and schools are really influential, because that's probably where either ourselves or our kids are spending over 50% of their time. And so we really have an opportunity to impact that environment. And then with each of these places, we have the opportunity to incorporate a bunch of different initiatives. So Blue Zones has like a list of best practices, a little different for each of the sectors. And then we go in and see what they're currently doing, and we really want to highlight all the good work that'll showcase a lot that people are doing, but then also see what they want to implement and help them implement more things. And then, you know, with groceries and restaurants as well, of course, they have the opportunity to help us promote healthy food and menu items. And again, we want to showcase all the great that they're doing. But again, the goal is to kind of shine light on more of the healthier things and to make it easier to be healthy. Our goal is not to take things away. It's really just to add more choices and options. And there is no requirement for anybody to participate in this. It's all just a volunteer. And then we'll go to the next slide. And pretty much our project exists here in Scottsdale. It's 4 years and 9 months. And then with the next slide, I just want to show you the timeline real quick of how it evolved. Pretty much, we started out with the first phase was community assessment. And it's good to note that Blue Zones doesn't go into communities, but more we have to be invited into the community. And so with us, it was actually Honor Health that you know, wanted the city of Scottsdale to improve their well-being. So they reached out to Blue Zones. And, you know, during the assessment stage, Blue Zones just assesses the community's readiness. Do we have the support? Would we be a good fit? They determined, yes, we were. And so the project work actually began in the foundation and planning phase. And then that was a 9-month period for us. And during that time, we identified a steering committee. So we have 15 different civic leaders that are very influential in our community on that steering committee. We hired our local team. So there's 11 of us on the Blue Zones Scottsdale team. And then also we have we did a lot of data collection here. And then the bulk of the work is in this transformation phase, and that our local team as well as volunteers are diving in to people, places, and policy work and making those change. So let's hop to the next slide. If you guys, you can either go out to our website, which is bluezonesprojectscottsdale.com, and you can see some great information as well as see our blueprint, or you could scan this. We'll go to the next slide. And actually, let's just hop to one more and how you guys can get involved. So again, you can scan this. It'll take us out to our website, and you can take a pledge. There's hundreds of different volunteer opportunities. A MOI is when we get a group of people together and they support each other. We have purpose workshops. And then lastly, I just want to highlight our sponsors on the last slide. So these are our Scottsdale community partners. So Honor Health has a huge footprint in this, as well as the Cigna Group, and then Goodwill of Central and Northern Arizona. So just, a special thank you to them, because our Blue Zones Project Scottsdale wouldn't be there without them. So thank you so much. All right, and I think we're going to hand it over to Dan. Thank you.
Okay. Sorry about that. I had to get back live. Dan Johnson here with the Wellness Council of Arizona. It's my pleasure to be a part of your format. Thank you for joining us. We are a nonprofit, 501c3. We've been around since 1985. I've been involved with the organization since 1995. So I'm celebrating 30 years coming up next month. And we support work sites. That's our main focus. Employees, the families of those employees, with everything from on-site health coaching and delivery of workshops, lifestyle challenges. We also do, here's a full scope of work. But when we're talking about the health coaching, we do close to 50,000 one-on-one sessions a year. Those are both on-site and telephonic, and also virtual digital platforms like Zoom and such. The Healthy Topic workshops, we have about 170 different topics. We were designed to be a support for work sites, and the delivery of what the interests are all customized. So depending upon what the employer would like for their group, their demographics, we look at their needs and their interests. So ICD-9 assessments to see if we're lining up our programming with the needs of the health status of the group, along with doing interest surveys to make sure that we've got the interests of the employees gathered to match up with those needs. And then that advances the healthy workshop topics, the lifestyle challenges. We have over 70 different lifestyle challenges. I'll share a couple of them with you here in just a little bit. We do fitness classes on-site and virtually, about 350 of them a month. We work with every major employer that I can imagine in the area. We're very fortunate. We support City of Phoenix, Maricopa County, Bash's and AJ's stores, Ping Golf, American Board of Radiology, every different type of work site that there is, both governmental and free enterprise. The programs that we do are related to physical activity, nutrition, stress management, self-care. Those are the 4 core competencies. In the area of self-care, we look at how does someone who has no health challenges still obtain optimal health. And then we look with to help people that have disease conditions such as diabetes, heart disease, musculoskeletal. And then we also help with health conditions, headache, back care, carpal tunnel, all of those types of areas. We don't do any medical delivery. It's all lifestyle support, encouragement, and motivation. Our health coaches are equipped with information in all of those areas, and they're fantastic. They have a sincere interest in the people that are working with the groups and help them one-on-one take small steps towards improving their health. I'll share a little bit more about that and the accomplishments in just a bit. So anything that an employer wants to do in the area of health promotion, we can either deliver or help with. For instance, we don't give flu shots, but we can help coordinate your events. We don't do biometric screenings at the work site, but we have providers who do, and we help to coordinate that. We do fitness assessments at the work site, 3-minute step tests, grip strength, flexibility screening, functional movement, and all of those. For instance, with Ping Golf, we've done that program with their biometrics for the last 7 years, 8 years, and their participants get their results from the previous 5 years at that new screening, so they can see their trends and which way they're moving with all of those areas. So basically, the programs are customized based on the demographics, the needs, the interests of the group. You'll also see that we do something called Verified by WellCoas. This is a program where we help to verify to the employer that the employee has completed the different processes and participations to earn their wellness incentive. So we do this for many, many groups. We have a great side reward program that we do that has over 400 different gift cards and the ability to double your money. If you were to give an employee a $50 bonus for completing something or participating in a lifestyle challenge, they can apply that to a green purchase on the website and double their money. It's pretty amazing. So there's no cost to the employers or to the employees, and it's quite immediate. So basically, the lifestyle challenges, we have over 70 of them. They can be conducted virtually or on site. And we're in the middle of one right now that involves a number of organizations that I'll share with you in just a moment. Let's go to the next slide. So this is an example of one that we're doing right now. Put a spring in your step. This has 22 organizations from all over the state participating in an activity program. And they are able to, as a group, earn a trophy, first, second, and third place. And individuals can be qualified to enter the drawings for a $300, $200, and $100 e-gift card. We have 22 organizations and 1,600 people all competing right now in this program. It wraps up, as you can see, on April 30th. This type of program we can do for your organization, have divisions between departments or locations, and it's just a great way to bring people together. All of the body wearables are connected to the portal so that we can have actual steps and minutes recorded by each of the participants. But this is just an example of one of the programs that we offer. Let's go to the next slide. All right, so this just promotes our annual celebration. We do this every 12 to 18 months. This last one happened in August of 23, Balancing the Art and Science of Well-Being. We're very fortunate in these events. We recognize and celebrate the accomplishments of organizations. There are 4 different levels that you can earn recognition and plaques and awards for, and also 3 different levels of individuals that are recognized at this event. We have the senior management, someone who has contributed to allowing the budget, the resources, the time, the effort behind the initiatives. We have a recognition for a wellness champion in the wellness committee area, somebody who has gone above and beyond to help to advance the program, encourage participation, and avail the delivery logistics in the program. The third one is really great. It's personal achievements. And we have organizations nominate individuals from their company to be recognized at this event. It's really great. Everything from weight loss to disease management, We had a 65-year-old woman run her first 5K. We had an individual run the Grand Canyon rim to rim to rim in less than 17 hours. So great accomplishments by employees that employers can nominate them and have them be recognized in front of hundreds of people at these events. So it's our pleasure when we get to do these, and we're very fortunate that the employers that we work with embrace the entire culture of health, wellness, and recognizing the efforts of the individuals in their groups to do it. So we're here to help with whatever it is that an employer group might want. Although we're a nonprofit, we don't receive any donations. So we are a fee-for-service model, but our pencil is very sharp and we deliver at a very affordable cost. Something that's coming up in the future that I want to share with you is two things. One, we have a behavioral health and well-being forum that's going to be, it's a virtual symposium that will happen in probably October. We're looking at the dates right now, but early October of this year. And the other thing is that we have a new partner coming online. It's called Holistically. And it is an app that is a health coach in your hand. And basically, you can ask any questions that you want about your health, about disease, about lifestyle. It also has a referral program for practitioners. So if you need to see or speak with a registered dietitian or an exercise physiologist or somebody in behavioral health or counseling or therapy, there are referral mechanisms within this program. And under the behavioral health area, it has insurance coverage availability. So it's just really a great program. We're going to be rolling that out in the next 60 days. And we're excited about how this is going to give support to anybody, anywhere, at any time, which is really great when it comes to the area of health and wellness and lifestyle. So it's been my pleasure to be here with you today. If you have any questions, you want to follow up, feel free to give me a call or contact at the Wellness Council, and we'll do everything we can to help you. So I want to give you this: strength, energy, and vitality. I hope you have a great day. Thanks for letting me be here. I do want to, I believe I'm supposed to introduce Michelle and Diana, and they are trainers, certified resilience to thriving trainers, great resource for everyone. So here you go, Michelle and Diana.
Thanks, Dan. Thanks for joining us. We can go to the next slide. So we're also, not only do we do the resilience, but we're also two of our three HAWP facilitators, so Healthy Arizona Worksite facilitators for the state, working with ADHS now. And so we kind of wanted to do a little bit of an overview, what's happening, what we're doing, and then we'll talk about some of the resilience stuff as well, since we're all three also resilience facilitators. So just kind of a program we just recently started pushing out is we saw, and it kind of makes sense with with all the data on burnout and things like that. But what we saw is right after COVID, a number of the work sites that we had historically been celebrating and that had become award recipients for HAWP actually kind of started to drive and fall off a little bit. And so we, in the last couple months or so, Diana, Teresa, and I have really kind of pushed together some opportunities to reach out to a lot of these work sites that were once recognized that were no longer being recognized, to figure out what was going on. A lot of it was burnout, turnover with staff, and not knowing where to start with being awarded and recognized by HAWP. So we started reaching out, and we call these workshops, so that they don't have to go through the original HAWP 101, that we call these re-engaging workshops. And so we're taking about an hour and a half with our re-engagement workshops. And we're kind of doing a program overview. What does Healthy Arizona Worksite stand for? What is our goal? What is our purpose? Why are we here? What resources do you receive from working with us? So we kind of go through all of that, the data collection, ways, best practices to collect data, what the scorecard tells you, the CDC scorecard, which is what we use. We then follow it up with a little bit of a break because none of us like to be on the computer for long periods of time, right? So we want to break it up a little bit because these are all virtual. And then at the second part of the session, we're really helping these work sites dive back in and complete their CDC scorecard, complete their WIP, so their worksite health improvement plan, give them ideas for that letter of support, how to establish their wellness champion team. So we're just really giving them those stepping stones so that when they leave our workshop after that hour and a half, they're actually have at least started that process of being re-recognized by the HAWP Awards. So that's one of the areas that we're trying. And next slide. So that's kind of our agenda. And because we realize that, you know, with HAWP, it is a statewide program. We provide resources for employees. We provide our expertise for work sites. We help them with different initiatives, ideas, brainstorming, helping them just to identify some of those health and wellness goals for their work sites. We actually also, what we really love in some of the opportunities within this re-engagement workshop is to help work sites connect to one another and create linkages so that they can actually generate ideas from each other and kind of start to build some more unity within our communities. So we give them a lot of those opportunities within that workshop as well. Next slide. And we walk through the program. So again, when we start to look at how HAWP recognizes work sites, so we go through a training program where we really establish that bottom foundational steps of starting a wellness program. We try to work with our populations and our work sites to help them take the next step if they're ready for the next step. So we have a new awardee, obviously they attend our HAWP 101 training, they complete their scorecard, they do all of those fundamental steps in building a wellness program, and then they're able to submit their application with some of these new, or excuse me, existing work sites that we're trying to bring back into the cycle. We're actually just letting them know, you know, if you want to be at the same level that you were awarded, you know, a year or two ago, then just submit your CDC scorecard and you can be awarded at that same level. If they want to increase their level, then at that point, they can complete the scorecard and submit the new application in order to show that they're increasing into a next level. So the copper, the silver, and the gold being those primary, and then our last level, which is the community component of a platinum award. If they do decide to do the platinum level application, and that's what they previously had, then they will have to again do the CDC scorecard one more time, but they'll also have to submit their submit a application because they'll need to update their narrative and their project data on what their community project component is. So that's kind of some of the things that we're doing. So that's the re-engagement side of things. We also have what we call technical assistance labs. So those are ongoing. And so those we have going on throughout. And this is, again, some opportunities for work sites to receive some one-on-one support from either Teresa, Diana, or myself, just to help them through some different pieces and parts with the HAWP Award. And then we have one last training for this award cycle. And that last training will be on April 30th and May 1st in the afternoon, 1 to 2:30, I believe. Registration information will be on the HAWP website. And I think that, I mean, if you want to pop the HAWP website in there, that would be great. They could register the HAWP website. And then in addition, on Monday, the 29th of April, we have one of our last re-engagement workshops. So if your worksite has previously been awarded and you haven't had a chance to jump on one of our calls yet, we would love to see you there. And you can do that as well. So with that, I'd like to turn it over to Diana. And then the next slide, please.
Thanks, Michelle. That was such a great overview. I really believe that the re-engagement workshops that we're doing are really helping some of the workforces that have dropped off, or maybe, like you said, haven't had a chance to get back into it, are doing it. And it's such a timely investment in not just the healthy workforce, but in people's wellness programs. As we're hearing today, you know, a primary area of concern and need in Arizona is stress and depression, anxiety, and all of those other kinds of issues. So very timely. This slide just states, you know, what we're really doing. We're investing in a healthy workforce. And these are the names of the trainers, myself, Teresa, Michelle, and how you can reach us. And then if there's any questions, please reach out. And then the next slide is going to talk a little bit about, before Dr. Bennett goes, I will just share a little bit about a resiliency training program that we are all certified in. Resiliency training is really teaching helpful mindsets and behaviors that allow people to not only cope and grow, but even thrive from challenges, from stress, and overcome these challenges, and to do it within a team situation, the team of their workforce. A lot of the training involves nurturing emotional wellness and fostering social connections, prioritizing self-care, which cultivates excellence and productivity within workforces. So how organizations are contributing to a healthy workforce is having one of us come in and do these trainings with their staff members. So if you need some information about that, please let us know. We're very committed and passionate about the work we're doing with resilience and healthy Arizona work sites. I had an experience that I'd like to share with this group. We did a training for resilience with a global roofing company a few days ago. And just on a personal level, I'll share, I was very surprised by the level of not only absorption of the information, but the transparency by these leaders on a personal level of their personal challenges. They were very present and they shared their presence at the start of the class. They gave a lot of takeaways and shared them at the end of the class. And they had a very big willingness to contribute the things that were challenging to them. And as I said, this was a roofing company. So many of the people in the room, they're about 30. I think out of the 30, there were perhaps 2 females. So many men who are maybe don't really talk much about their challenges. So it's such a great opportunity. So I just wanted to share that personal experience with everybody. All right, so I guess the next slide is our introduction to Dr. Bennett, and I'm going to turn it over to you, Dr. Bennett.
Great. Thank you. Can you all hear me?
Loud and clear.
Yeah, so thanks so much, Diana and Michelle. I put in the chat box, the last HAWP webinar that we did was recorded, and you can see the links to that YouTube recording. And that recording goes into more depth on the resilience and thriving classroom training. I want to be clear that that training is available to you in your workplace. Just contact Michelle or Diana, and their emails will be available at the end of this webinar. But please go ahead and watch that video if you're interested in learning more. So I'm going to sort of wrap up this part by reintroducing the model that we talked about at the beginning. Next slide. Well, first, let me first go over and talk about a couple of tools. So Irene is going to go ahead, I think. Well, we're going to go there. Here we are. Great. So I thought it'd be helpful to go back and recap what we've talked about today. This is the last of 5 community of practice webinars. The work we've been doing, OWL's Organizational Wellness and Learning Systems, we've been doing with HAWP now for almost 2 years, has been to try and get more re-engagement. So the work that Michelle and Diana are talking about is part of the deal. But the bigger issue here is sustainability. So as you heard from Blue Zones, and you heard from WellCoA Arizona, there's interest in building this community, this, if you want to call it a continuum of practice. And it can't happen without you. It cannot happen without you. So there's lots of resources here. Irene has a lot to offer with the Community Health Improvement Project. You saw ways you can contribute there. You have opportunities for participating in award programs with both HAWP and also with WellCoA Arizona. But the key issue here that we see over and over and over again is mental health. And the resilience training is designed it's a prevention program, primary prevention, for helping people actually get mental health support. It's an evidence-based program, and people who actually go through the program are more likely to reach out for help. And actually what we've seen is increased utilization of the employee assistance program, increased utilization of stress and mental health resources. So with that, next slide, please. What HAWP has done under Irene's leadership and the links are just sent in the chat box, has created a resource guide. So this is an example of things you can use right away that might be helpful for areas related to stress. Next slide, please. One of the key resources that employers have, and I will tell you, regardless of what people are saying, it is still the most underrated and most highly effective resource you can use, and that's your employee assistance program. It does require effort and thoughtfulness, but the return on investment on EAPs is one of the best and most sound returns you can get. Again, it does require thoughtfulness and working with your benefits manager to make sure your EAP is providing. So what we know, it's really a work culture effort that makes the EAP successful. Really good internal programs at big organizations have had EAP eternally for 10 to 20 years, and their average utilization is in that range of 10 to 15%. We know this. And so the real goal here and the whole purpose of this last webinar is collaboration, collaboration, and collaboration. In the case of EAP, we're talking about EAP collaborating with wellness, wellness collaborating with EAP, HR, and organizational development. Next slide. And also another point to how to leverage your EAP is to go beyond clinical topics and treatment only and move more to prevention education, like the resilience training, like the work that Blue Zones is doing, like the work that WellCoa Arizona is doing. Regular orientations to managers and HR staff about the purpose of an EAP is very effective, but also use every training or touch point on key proactive and destigmatized topics. We know employees like especially face-to-face programs on resilience, work-life balance, sleep, positive life events, marriage, childbirth, as well as prevention for depression, anxiety, substance use, and suicide. So you have a wealth of resources available to you. It's an amazing thing that we've got all these different people here today ready to support workplaces. Next slide. The other thing is that we published an article with Benefits Magazine a few months back that goes into more detail on how to leverage your EAP for a mentally healthy workplace. I think Irene's going to put this in the chat box, and it just gives you a lot more detail on how to go ahead and be tactical with leadership to get your EAP in there, because as we saw, mental health is the #1 concern. So this is another resource that you have. Next slide. So to leave today, and we'll hopefully have some time for Q&A. So if you have any questions, now's a good time to do it. We thought might have time for discussion, but I think we've run out of time. So I'll just be very quick. Moving forward, be proactive. Talk to each other. Talk about what inspires you. Share your HAWP profile, your CDC worksite scorecard with your colleagues. Use the resources that we provided. Consult your EAP, your community. Again, with the CHIP initiative and the work that Irene's doing, that's there. It's your tax dollars going to pay for Irene. And then evaluate. So that, I think, are the basic tips moving forward. I'll turn it back over to you, Irene. And maybe, I'll just say that for us, we do a Resilience to Thrive coaching training as well. If you're interested in learning how to be a Resilience to Thrive coach, we'll also put that in the chat box at the end.
Awesome. Thank you, Dan. And thank you to everyone. I have listed here everyone that spoke today in their emails. So if you have any questions, feel free to reach out. We do have a couple minutes still if you want to put a question in the chat. But I just wanted to give a big thank you and shout out to Dr. Bennett for helping support us with this project with the community of practice for the Healthy Arizona Work Sites. And hopefully we can continue this on, whether you are doing a Resilience to Thriving training, coming to support this work in the CHIP, like he said, with doing work groups surrounding mental health in the workplace or anything like that. So feel free to put any questions. But again, big thank you, Dr. Bennett, for supporting this project.
My pleasure. Yeah. Any questions? So we have any last few minutes here? Anything that anybody wants to say, or anything from our panelists? Any comments or follow-up? Well, I will say, blue zones in Scottsdale. Scottsdale does not have to be the only city in Arizona that has blue zones, right, Chris?
That's right. We just need an individual, an organization, or someone in the community just to express interest and reach out to blue zones.
How about Tucson, Dan?
Yeah, there you go.
Yeah, definitely a possibility. I'll have to get with Chris and talk some more. We've known each other for many years, so I'm glad you're with the project, Chris, and you'll do great things for them. So.
All right, thank you, Dan.
And if anybody needs any help with worksite wellness, whether it's just a viewpoint or a delivery point, we're happy to help out. It's great to be here today.
Yeah.
Yeah, thank you.
Yeah, thank you again. Thank you, Dan and Chris, Michelle, Diana. Dr. Bennett, everyone for being here today.
Irene, what are you going to do for the rest of your life before we jump off here?
I have no idea. I know for the next few months what I'll be working on, so come support the HIPMC with the work on the Community Health Improvement Plan. And we'll see where that takes us.
Yeah.
I'm excited.
Well,
All right, well, no questions, just a lot of thank yous. So I will go ahead and give you all 2 minutes back to your day. Thanks again, everyone, for coming, and all of our speakers. Have a great rest of your day.
Thank you, guys.
Thanks, everyone. Take care. Be well.